Hi and welcome to the video. I'm Andy. I'm a psychologist by trade and a trained depression specialist. And I feel like today let's talk about depression. So depression is a really big problem in society at the moment. It is very, very widespread. Most people have experienced episodes of potentially extreme depression throughout their lives. And some people may wonder if they've got depression or not, and this might be why you're looking at this video right here, right now. So let's look today at some of the warning signs that I would look out for if someone might have depression. And this will give you some ideas on whether you may want to seek some support for depression or not. We'll just go through the symptoms. So some of these are informed by the diagnostic criteria for depression. There's, generally speaking, 9 diagnostic criteria of depression. Some of them will be things that I will generally notice as patterns in people who have depression as well. At this point in my career, I've worked with people who have depression for about the last 7 years specifically. And at this point, I've treated probably hundreds of patients that have had it, generally fairly successfully as well. So if you are really struggling with this at the moment, it is really worth recognizing that it is a treatable problem. There is help out there for it, and it can be fixed, even if it feels like it can't right now. So let's look at some of the warning signs that I might look out for when someone could be depressed. So the first thing to recognize with depression is it's not the same thing as just feeling low. It's not having a bad day. It's a prolonged disorder. It can come and go in episodes over time. In fact, it's quite normal for it to come and go in episodes over time. So you may get a bad week, a bad month, and then things start going okay again. Before you know it, you're having another bad week or another bad month, or potentially a few months, potentially even a year, depending on circumstances and various other factors. It is very normal for it to ebb and flow over time. And there are reasons for that, which we'll go through in a future video, because that's going to take about an hour to explain potentially. But it is a both mental and physical reaction. And that's really, really important to bear in mind. It's not just you're feeling a bit sad. It's a full response, both physically and mentally, to usually extreme stress, essentially, or potentially prolonged stress over time. So the things that we may look out for are both mental and physical symptoms, but also behavioral symptoms as well, generally speaking. So physical symptoms, they tend to be essentially things down the lines of a slowing style of effect. So you may feel a very physical slowing. So it feels like your body's just not moving in the way that it normally would. You're still doing things that you would normally do in your day to day, but you're just not moving as fast as you otherwise would, to the point where you might feel like other people could notice. So, for example, if you're doing the dishes, it feels like the dishes are taking you twice as long to do them, but for no particular reason. Like, you may not recognize that you're slow, but it just feels like everything's just taking a lot longer, and you're able to get a lot less done in the day than you otherwise would before you're kind of running out of time as well. You may notice a mental slowing as well. So you may find that it's difficult to think clearly or think as fast as you otherwise would. You're still getting there in the end, but it feels a bit muddy. It feels a bit like you're, a phrase that we tend to use in the UK is almost like walking through treacle or walking through like a thick custard or something like that. Like it's just foggy in your mind. And because of that, you may also notice other problems as well cognitively, cognitively meaning in your thoughts. So you may find, because of this mental slowing, it's really difficult for you to hold your concentration on things. It may also be really difficult for you to remember things as effectively as you normally would. You know you have these things in your mind, but they're right on the tip of your tongue, or you just can't quite hold on to this kind of information. You might start forgetting jobs that you need to do in work, for example, or you get halfway through cooking your dinner and you realize you forgot to put in one of the major ingredients, or things like that. You might start to feel more clumsy in a way because of this as well, because of this kind of physical and mental slowing. So this is a really, really big red flag that I would generally look out for. Looking for other symptoms that we could link in with this physical response as well, you may also notice sleep disturbances. So when I say sleep disturbances, it can go in both directions. You may sleep a lot more, you may sleep a lot less. And you may even find that you alternate between the two. You might get a few days where you don't sleep at all, and then you have a big crash, for example, where you sleep loads in one day, and then you go back to not sleeping very much. Either way, it's disturbed. And when it comes to sleep disturbances, there's a lot of different reasons that can cause them. You may find that it's hard for you to fall asleep at night because your mind is just dwelling on all of the things that may have gone wrong. It may be you can fall asleep okay, but you're waking up in the night a few times, either just randomly for no specific reason. It might be from stress dreams. It might be lots and lots of different things. You may sleep through the night, but you're just waking up early, for example. You may wake up an hour before your alarm and then you can't fall back to sleep again afterwards. It may be, like we were saying, you feel like you just can't get enough sleep in the day as well. So it might be the case of normally you get 8 hours and suddenly you're starting to sleep 12 hours in a day and you're napping all the time and you're just constantly feeling tired as well. This sense of tiredness can be associated with this physical and mental slowing that you might get as well. You might feel like you're constantly resting, but you never feel rested. So that could be another red flag that you might look out for. The other thing is appetite disturbances. So appetite disturbances, again, it can go in both directions. You might eat a lot more than you normally would. You might eat a lot less than you normally would. There's a few reasons for this. One of them is depression being associated with stress. Stress responses tend to slow our digestive system down, and they tend to cause essentially inflammation in our digestive system. There is a high correlation with inflammation in the body and symptoms of depression as well. And what that may mean is if our digestive system is essentially inflamed or slowed down, then essentially we're not going to feel as hungry as we normally would. And that might mean that we start skipping meals or things like that. We may also just find, if we are feeling low, that we're just not motivated enough. Like, we really know that we should eat. We are feeling hungry, but we just can't get ourselves up and out of the bed to do this as well. Maybe because we can't, because of mental slowing, we might find that we just can't make that decision to choose what we want to cook for food or things like that as well. So indecisiveness is also usually quite a subtle sign of depression. It's not one of the big red flags I would look out for, but as a side note, it can be something that people with depression really struggle with as well. So on the flip side, you may find that you're eating a lot more, and usually eating a lot more, it tends to come from a kind of coping strategy style approach. So we've all been there where we've eaten some junk food as a way of essentially making ourselves feel better in the moment. When we are depressed, if that's a coping strategy that we've used throughout our life to manage things when we're feeling bad, that's going to make us want to rely on that a bit more. The other thing is, as part of this stress response, our body changes how it processes sugars and things like that. I won't go into loads of detail, but that can lead to more sugar cravings, essentially, when we are feeling more stressed or more depressed. Once we start falling into that cycle of eating junk food, then we're going to go through highs and lows as we get that kind of like sugar buzz, and then we get the sugar crash that follows. Then we're going to want to re-regulate, so we're going to crave more sugar once we get to that crash point. And it's a bit of a vicious cycle that can keep going over time, essentially. So you may find your appetite increases or decreases. Similar with your sleep, you may find that your craving for sleep increases or decreases or alternates between the two. The other thing that I've essentially alluded to a little bit so far is motivation. Motivation is probably the first thing that a lot of people notice as well. So when it comes to depression, quite a lot of people may either almost gaslight themselves and call themselves lazy, or you may get comments from other people as well. And maybe you've got critical parents or a critical boss who might be insinuating that you're just being lazy because you're not doing basic chores around the house, or maybe because you're not going and seeing your friends in the way that you normally would, or things like that. Sometimes with motivation problems with depression, it can be a global, everything gets reduced. So whatever the task is, we just don't want to do it. For some people, it may be the case that we can do some things absolutely fine, and then other things we just literally can't bring ourselves to do it. So it may be you're able to see your friends, you're able to do your hobbies, all of those things that you normally enjoy, absolutely fine. But as soon as it comes to doing anything work related, maybe studying or anything like that, you just can't bring yourself to do it. And it may feel like you don't really know why that's the case, but you just can't do that. And it's not laziness, it's part of a response system that our brain can go into. So when we are in a depressed mindset, essentially our brain is trying to conserve energy. It's trying to force us to go into a resting state. And I will upload a new video. I'm aiming to record it today around why our brain is wanting to go into this resting state and how depression is linked in with stress. So if you find this video useful, please look at the channel and find that video. You might find it useful as well. So motivation can really drop. You may also find the alternative happens where you can do all of your daily chores, your daily jobs, all of those things absolutely fine, but you're not really doing anything for fun. You may even find that you have something called anhedonia, which is where you essentially stop enjoying things that you feel like you should enjoy or that you used to enjoy. Just something isn't quite clicking with them anymore. And you may also find that you go through periods of highs and lows with motivation as well. So there is a concept in depression called boom and bust, which a lot of people can fall into, where we essentially struggle with motivation for one reason or another for a few days. So this is the kind of bust phase where we're not doing much. And then as soon as we start to feel a little bit better, whether something happens that gives us a mood boost, whether it gets to the end of the working week and we've got a bit more energy to play with because we're not working that day or things like that. And we feel like we've fallen so behind in everything that we essentially have this big burst of activity. We really push ourselves to catch up with everything, clean the house, do the shopping, do all the chores, catch up with all of our life admin. And then that burns us out essentially in a short-term kind of way. And that makes us crash again. And suddenly our motivation's at rock bottom again. And it just feels like we're constantly in this game of catch up with ourselves whenever we get a small burst of energy. That can be a really, really common pattern in depression. And there will be, again, a future video exploring how we can break that cycle as well. So other things that can happen is, sorry, I've got a list in front of me just to jog my memory. So if I'm looking down, that's why. And other things that may happen is essentially that we may be very hypersensitive to any kinds of knockbacks in our day-to-day life. So this may be mistakes that we make or perceived mistakes that we make. It may be criticism from other people. It may be just generally things not going as well as we would want them to, things like that. We can be really, really hypersensitive to any of those kinds of knockbacks in a way that we normally never would be as well. We may also notice a heightened sense of guilt. So when I say this, we may feel, if it is something that we would normally feel guilty about, like we've upset a friend or something like that, we may feel a disproportionate amount of guilt to the problem at hand, if that makes sense. So you'll feel a disproportionately high amount of guilt to what you would normally feel. And your mind may essentially hyper-focus on that thing as well, whilst you're depressed. The other thing is you may start feeling guilty about things that never normally would be a blip on your radar. Like you may assume that you've made some mistakes, or you may assume that you've made someone feel a certain way, you've said the wrong thing or things like that. And you start to feel really, really guilty about these essentially hypothetical scenarios that you're convincing yourself are true in your mind. And you might respond in ways to people accordingly, and they might essentially give you a bit of pushback. They might say, what are you on about? Or things like that, or you don't need to worry about that at all. Don't worry, you didn't do anything wrong, or things like that. So if you're starting to notice those kinds of patterns, that may be a sign that there's some level of depression going on in the background. Other things are, and this comes hand in hand with motivation in a way, is something I tend to call a low future focus. So quite often with people with depression, they will have negative views of generally three things. So the first one is their future. So they will have a generally bleak view of their future. And this may be their personal future. So I'm never going to be settled down with a house and a family. This may be I'm never going to get the job that I want. This may be I'm never going to pass this university course. Anything relevant to the stage of life that you're at, for example. It may be a bleak view of the future in terms of essentially the world around us as well. Like just feeling like the world isn't going in a good direction at the moment, or things like that. Those kinds of views of the future as well could also be a factor. The other thing is yourself. So you can have a negative view of yourself, and this can tie into maybe some potentially really strongly held beliefs that you may have had about yourself for a really long time. And these beliefs may not be present all of the time, depending on your mood, but when you start feeling low, these beliefs may really, really creep in quite strongly. So this could be seeing yourself as a bad person. This could be seeing yourself as a not good enough. Generally, it could be seeing yourself as unlikable, anything like that. And these deeply held beliefs can influence your moment to moment thoughts. So you might think about things in a certain way. If you see yourself as unlikable, you might start thinking about social interactions in a certain way where you're looking for anything that you could have done wrong, for example, or you might assume that people think negatively of you and they're judging you behind your back or things like that. If you see yourself as not good enough, then this might lead to some imposter syndrome at work where you feel like you're not actually good enough to do your job and your boss kind of made a mistake in hiring you and hopefully your boss doesn't notice. So that may influence your behavior at work as well. You might start avoiding any kind of authority figures, or you're really sensitive to any feedback that they give you or things like that as well. And this can really lead into quite a lot of thought spirals here. So this may lead you to a process called rumination. And rumination is where we essentially repeatedly go over events in our mind. And this is really, really common with depression, where we just keep going over it and over it and over it, not to any kind of productive conclusion, not in a way that's going to help us going forwards or things like that, but we're essentially beating ourselves up in a sense. So, this might be a mistake that you made in school where you really embarrassed yourself, or it might be a perceived mistake that you made today at work or something like that, or you said something, a joke that just didn't really go down very well, things like that. And you may just go over it and over it and over it and over it. And this is going to be reinforcing those negative beliefs that you might hold over time as well. So if you see yourself as not good enough and your mind keeps going back over that, then it's going to make you feel that sense even more, essentially. So these are all of the big red flags I would normally look out for in someone who has essentially depression of some level, whether that's major depression, which is quite severe depression. It may be minor depression, so you're still depressed, but you're still able to function, things like that. Like, it may be lots and lots of different factors, but generally speaking, I would split it into three main areas. So you've got your thoughts. These would generally be self-critical. These would be quite pessimistic overall. These would generally be very negatively biased as well. You might struggle to accept anything positive. You may struggle to notice anything positive. You're going to have your physical responses. So you're going to feel maybe quite lethargic, maybe quite fatigued, mentally and physically slowed. You may find that you're sleeping a lot more or struggling to fall asleep. You may find that your appetite is either higher or lower as well. And then behaviorally, generally speaking, we're looking at things like motivation being lower, or because of the thoughts that you might be getting, that can influence how you might behave. So if you're feeling like you're unlikable when you're feeling more low, then you might start avoiding your friends. You might withdraw from your friends as a coping strategy. Or if you're feeling like you're not good enough, you're always making mistakes, you might start avoiding people in work, or you might start putting things off that you would otherwise do normally because you're afraid of failure, or maybe making a mistake that could make some kind of situation much, much worse overall. As I touched on at an earlier point in this video, you may also find it's really hard to make decisions as well, which can really impact how you're going about your day. You might find that you've almost got this decision paralysis, and that means that you end up procrastinating a lot more because you can't decide what to do with your time. Or you may find that you've got this anhedonia, like I mentioned earlier, where you're withdrawing from things that you would normally enjoy just because you just don't really feel like you're getting as much out of them anymore. Or you may find that you're withdrawing from chores, jobs, all of those necessary things, and then that might, a really, really common cycle in depression is you don't do those jobs because you struggle to motivate yourself, and then later on in the day you feel guilty because you don't feel like you've gotten anything done, you've not been productive that day. So these are all the big red flags I would normally look out for in someone who has depression. The duration of these symptoms can vary a lot depending on what the type of depression is or lifestyle factors, things like that. But generally speaking, if it were depression, I would expect this to be a consistent symptom over a prolonged period. So, or a consistent set of symptoms, sorry. So I would expect you to be experiencing them for maybe weeks at a time, maybe months at a time, things like that. It can arguably be quite normal to experience some of these symptoms for a day or two. That could just be you've had a really busy week at work and you're kind of crashing out a little bit after getting through it. Like maybe you're in a crunch time for a deadline or things like that. I'm not saying it's not a problem, but it can be potentially perfectly normal to have this response for a day or two. But if it's at a level where it's causing you problems in your day-to-day life, you're not keeping up with things in your day-to-day life as you should be, or as you feel like you should be, then that might be the point where you might want to seek help with it. So when I say problems, this might be calling in sick to work. This might be you feel like it's really having an impact on your social life because you've distanced yourself from your friends for a while now, and it's starting to cause some friction in those friendships. It might be your house is consistently a mess and you've got piles of dishes that need cleaning or things like that, and you're just not able to bring yourself to get on top of them. Again, doing this for a day or two can be perfectly normal, but if it's going on for a week, if it's going on for a few weeks, like, is that maybe the point that you might want to seek help? And I appreciate there may be a bit of a global audience for this video, so I won't give any advice on seeking help, but it might be worth seeking therapy. It might be worth seeking online content that's going to give you some ideas. As this channel grows, I'm going to fill out on a lot of different ways that you can start to approach things like depression. And yeah, if you feel like this is a useful video, please like it, leave a comment, subscribe to the channel for more content going forwards. If there's anything you would like to see specifically in a video, then definitely let me know in a comment below and I'll see what I can do. But otherwise, thank you, all the best, and bye for now.